Hey everyone, welcome back for another deep dive. And today we're tackling something pretty intense, intubation.
Oh,
It's
yeah.
one of those things you see on medical shows and it always seems so high stakes.
Right.
But we're going to break it down. When is it really needed in real life? And why is it so important? And how do you even talk about it with your family?
When it comes up.
Exactly, because it can be a really tough conversation.
Yeah, for sure. It's definitely not just a TV drama thing. It's, a real medical intervention.
Yeah.
And it is kind of amazing that something seemingly so simple, like putting a tube in, can make such a big difference.
Right. So let's start with the basics. What is intubation and why do doctors use it in the first place?
Okay, so think of it this way. Your airways, they're like the highway for oxygen to get to your lungs, right?
Okay.
But sometimes there are roadblocks in the highway, Maybe an injury.
Yeah.
Maybe a really bad allergic reaction or an illness that's messing with the lungs themselves. Oh. Intubation, it's like creating a detour, a clear path for that oxygen to get where it needs to go when the normal route's blocked.
So it's like bypassing the obstacles.
Exactly.
Okay, that makes sense. But when would someone actually need intubation? It's not for every little cough, right?
No, definitely not. It's only for when someone can't breathe well enough on their own, and we've got sources here that talk about a bunch of different conditions where it's needed, and they're all pretty serious stuff, like pneumonia for one.
Oh, yeah.
That causes inflammation in the tiny air sacs in your lungs.
Yeah.
Or ARDS, acute respiratory distress syndrome. Have you heard of that?
ARDS.
Yeah.
That sounds pretty scary.
Yeah, it's life-threatening. Fluid builds up in the lungs and it makes breathing incredibly difficult.
Wow.
It can be caused by all sorts of things. Infections, trauma.
So intubation in those cases would be absolutely critical.
Oh, for sure. You've got to get oxygen into the body somehow.
Right. Are there other times when it might be necessary?
Definitely. Like if someone's having a severe asthma attack, and the medicines aren't working well enough.
Yeah.
Their airways get so tight, it's almost impossible to breathe.
Oh, wow.
Intubation creates that clear pathway we were talking about. Make sure they're getting enough oxygen.
It's amazing how this one procedure can help in so many different, life or death situations.
It really is.
What other medical emergencies would you add to that list?
Well, cardiac arrest is a big one.
Oh, right.
When the heart stops pumping, the lungs can't work properly either.
Yeah.
So intubation, along with CPR, is essential to get things going again, breathing and circulation.
So it's like a frontline tool.
Absolutely.
What about in cases where it's the lungs themselves are failing, maybe from a chronic condition?
You're thinking of things like COPD, chronic obstructive pulmonary disease.
Yeah.
It's a progressive lung disease that makes breathing harder and harder.
Right.
In severe cases, intubation and a ventilator might be needed to support those lungs.
Okay, so we've covered a lot here, from these sudden emergencies like cardiac arrest to long-term things like COPD. It seems pretty clear that intubation is super important for helping people breathe in all kinds of medical situations.
Yeah.
But I imagine there are also times when patients or their families might be unsure about intubation.
You're right. It's not always an easy decision, even though it can be life-saving. You have to think about people's beliefs and values.
Exactly. We have this source that talks about how cultural factors, especially in the Filipino community, can play a role in decisions about intubation.
Right.
It's really interesting. It reminds us that healthcare isn't just about the science, it's about people too.
Absolutely. One of the big things that came up was the influence of faith and family. Many Filipinos believe that death is God's will, and so they might hesitate to use medical treatments like intubation.
Right.
They might see it as going against a divine plan.
That's a really powerful perspective, and it makes you realize you have to approach these conversations really carefully.
Yeah.
It's not just about explaining the medical facts. You have to understand where the patient and their family are coming from.
Mm-hmm. Exactly. And it's not only religious beliefs either. Family is so important in Filipino culture.
Oh, yeah. Close-knit families.
Very close. They often make healthcare decisions together.
So you could have a patient who's open to intubation, but their family is not.
Exactly. It adds another layer of complexity.
For sure.
Yeah.
So how do doctors and nurses navigate these conversations when there's resistance to intubation, especially when cultural or religious beliefs are involved?
That's a really important question and something we're going to discuss more in the next part of our deep dive.
Okay. Looking forward to that.
Yeah, me too.
Okay. So we're talking about this really tricky situation where a procedure like intubation could be life-saving, but there are these cultural and spiritual beliefs that might make families hesitant.
Right.
It's this balance between respecting their values and trying to do what's medically best. So where do you even start those conversations?
It's tough for sure. There's no magic formula, but what our sources really emphasized was open communication. You have to really listen to the family's worries, not just, give them a medical lecture.
More like building a bridge than, dictating what's going to happen.
Exactly. And you have to acknowledge their fears, especially when those fears are coming from such deep-rooted beliefs. Like with Filipino families, they might worry that intubation is going against God's will or that it's going to make their loved one suffer more.
Right. Those beliefs about divine providence and not wanting to interfere.
Yeah. So the question is, how do you explain why it's medically necessary while still respecting that perspective?
Right. Because you can't just dismiss their beliefs.
Exactly. One way to approach it is to frame intubation as something that actually supports God's plan.
Okay.
Like you can say it's about giving the body a chance to heal, maybe even time for a miracle to happen.
So it's not medicine versus faith. They can work together.
Right. And it's really important to make sure the family knows that their loved one's comfort and dignity are the priority.
Because I bet they picture intubation as this painful, scary thing.
Yeah. A lot of people worry about that. So you have to explain about sedation and pain management. You have to reassure them that the goal is to lessen suffering, not make it worse.
So it's all about being really transparent and compassionate.
Absolutely. And also making sure the whole family is involved.
Yeah, because Filipino families tend to make decisions together, right?
It's a group effort. So you can't just talk to the patient. You have to include everyone, make sure they feel heard.
It's about respecting that family structure.
Exactly. And sometimes it helps to actually show them what you're talking about, like a diagram.
Right.
Or an illustration, especially if there's a language barrier.
That makes a lot of sense. Visuals can be so helpful.
Yeah. But then there's the financial side of things, too.
Oh, right. That can be a huge worry for families.
Definitely. Prolonged medical care can be expensive. So you have to be honest about that and let them know about any resources that are available.
Like financial aid or payment plans.
Right. It's not just about the medical stuff. It's about supporting the whole family.
It's a lot for healthcare providers to handle on top of everything else.
It is. But these conversations are so crucial.
Yeah.
It can make the difference between a family feeling like they're part of the process or feeling totally lost and scared.
It's about giving them back some control.
Exactly.
So are there any specific phrases or ways of talking to Filipino families about this that really seem to work?
That's a really good question and something we're going to get into in the last part of our deep dive.
Okay. I'm interested to hear more about that.
Me too.
All right. So we've talked about how important intubation can be and also how tricky those conversations can be, especially with families from different cultures, like with Filipino families where faith and family play such a big role. So what are some phrases or ways of talking to families about intubation that really seem to work? Ways that show you respect their beliefs and values.
Yeah, it's all about understanding those nuances.
Yeah.
Like one thing to remember is that respect for elders is huge in Filipino culture. So if you're talking to a family, addressing the elders directly, using those honorifics like po and opo, it can really make a difference.
Right, because it shows you understand their role in the family.
Exactly. And always keep in mind, Filipinos are so family-centered. So using phrases like, we want to work with you to get the best outcome for your loved one, or we know how important family is in making these choices, that can really resonate with them.
Yeah, it's more like we're all in this together.
Right. And then when it comes to those fears about suffering, a lot of people worry that intubation will just prolong the pain.
Yeah, that makes sense. It's a natural fear.
So you have to address that head on. Reassure them that their loved one's comfort is the priority.
Okay.
Like you can say, we'll do absolutely everything we can to make sure they're not in pain, or we're going to be monitoring them constantly and make changes as needed.
So you're giving them specific things you're going to do to help.
Yeah, exactly. But what if, even after all that, the family is still unsure?
That's got to be tough.
It is. Sometimes what can help is appealing to their sense of responsibility and love for their family member,
Okay.
Like you might say something like, we understand your hesitation, but we truly believe this gives your loved one the best chance of getting better. Or maybe, we know this is so difficult, but we think this is what they would want.
So you're kind of reframing it as an act of love.
Right. And don't forget about their faith. That can be a big part of the decision-making process.
Because some might see it as going against God's will.
Exactly. So you can try to reframe intubation as a way to actually support God's plan. You could say something like, we believe that this treatment is giving your loved one a chance to fight, and it allows God's healing power to work through us.
Okay. So you're finding that common ground between faith and medicine.
Exactly. It's not always easy, but it's so important to have these conversations with sensitivity and understanding.
Absolutely. And for everyone listening out there, I hope this deep dive has given you some insights into how complex intubation can be. It's not just the medical stuff, it's the cultural and emotional side too.
It really is.
If you ever find yourself facing these kinds of decisions, remember to communicate openly, listen carefully, and respect those different beliefs. And don't be afraid to ask for help from healthcare professionals who understand your culture and values.
Great advice.
Thanks for joining us for this deep dive. We'll see you next time. Keep those minds curious and keep those hearts open.
Bye, everyone.